you are born in Nigeria as a Nigerian, life is already ahead of you. And you, if you are not born really rich or with really wealthy parents, life is ahead of you like 10-0. Unfortunately for most Nigerians, the disadvantages of being broke go far beyond the inability to cry independently. Over 3,400 people die from tuberculosis every day, and in 2023 alone, over 10.8 million new cases were recorded globally. Nigeria accounts for about 4.6% of those cases alone, and in 2023, we actually had 400,000 tuberculosis cases, which was a record high for this country. According to the World Health Organization, 60% of those patients live below the poverty line.
You'll soon understand why.
Tuberculosis is caused by a bacteria called Mycobacterium tuberculosis. So, like it, when you cough, when you sneeze, and sometimes when you talk, it spreads around. It cannot be spread through handshakes, it cannot be spread through food, and it cannot be spread through surfaces. It requires being on a particular place for a prolonged amount of time with poor ventilation for it to be spread, which is why it might seem more apparent in poor people, because people that cannot afford to live in places that are well ventilated with a lot of space and have to manage what they have are generally poor. Children, elderly, malnourished people, and people with weakened immune systems, people with HIV/AIDS, diabetes, cancer, or people that have just undergone an organ transplant, they are more at risk for getting this disease than other people, as well as I've mentioned, people that live in poorly ventilated spaces. On the brighter side, tuberculosis is preventable and it can be treated. And the first step to knowing this, to getting this done, is actually knowing the symptoms. Now, symptoms of tuberculosis include persistent cough for about 3 weeks plus. It also includes night sweats, unexplained weight loss, fever, chest pain, and breathing difficulties. These are all symptoms of TB. Now, recognizing this is the first step to control. The treatment plan takes anything between like 6 to 9 months. But the good thing is, after 2 to 3 weeks of consistent treatment, it no longer becomes contagious. It has not gone. It just means you can't spread it to someone else. But this doesn't mean you should stop your drugs. You really have to finish using your drugs. It has some specific drugs such as isoniazid, and then it includes some antibiotics in the mix. Now, the disadvantage of stopping your drugs midway, because I know the thought of using drugs for months is quite arduous and not something a lot of people will do, is it's going to lead to drug resistant tuberculosis. And the drugs you're using before is not going to treat it. You're going to need new drugs, it's going to go for a longer time, and it's going to be more expensive. So it's better to just face what you face and get it done with so that you go and leave your body. Ways to prevent tuberculosis, like I said, make sure you finish your drugs to prevent drug resistant TB being developed. The BCG vaccine given at birth protects you from a more severe strain of tuberculosis, particular type of tuberculosis that actually affects all of the organs and the entire body. Cover your mouth when you're coughing. Wear nose masks or face masks when you know you have TB. Do not cough on people, and just stay in ventilated places as much as you can. Now, people with weak immunity, people with HIV/AIDS, people with cancer, people with diabetes, and the elderly should try and get screened for TB regularly. I hope you've learned a few things about tuberculosis in this video.
Have a good day.